Hi, welcome to the world of cardiology, the study of the heart. This is Dr. Jaitly. I'm going to be talking to you about, in this pertinent section, what are the symptoms of a heart attack. We know the heart attack occurs because one of the arteries which are supplying the heart, they get blocked abruptly. Whether it's a clot or other numerous mechanisms that result into a clot or a diminution of blood flow across these coronary vessels which are supplying the heart. Remember, the heart supplies the body, but heart has its own supply. And when any of these supplies get cut off, obviously it results into a death of a muscle. Why? Because the heart is a muscle and that area is compromised severely or significantly. As a result, the death ensues of that portion of the heart muscle, resulting into the weakness of the heart. Now, we need to recognize the symptoms first before we present to the doctors, right? So very importantly, one should be aware that there are certain very alarming symptoms that the heart attack presents with. This is the interior structure of the heart, as we have seen it before. 2 chambers on the top and 2 chambers at the bottom, this being the most important chamber. Why? Because the left ventricle is the booster chamber, is the big guy which is sending blood across to the entire body. So it has to be a very powerful ventricle, a very powerful chamber out of the 4. So if this suffers, everything suffers. So it's very important, paramount importance, that left ventricle needs to be totally intact in order to function normally. So what are the symptoms of heart attack? Well, the commonest thing is the chest pain that occurs in the center of the chest, that the patient defines it as a discomfort or a tightness sitting right under your sternum or your breastbone, if you will. And that may last for about half an hour to an hour. If it's a very significant chest pain, sometimes accompanied by breathing difficulty, where the person is not able to complete a sentence or even walk from one room to the other, or not be able to be on the phone for too long, that'll make you sense that there is something very alarming happening in that individual. Dizziness or passing out spell implies that the heart muscle is getting weaker and weaker, and therefore it's not able to pump the blood through the aorta, and therefore the patient's blood pressure, which is the blood flow occurring through various vessels throughout your body, is diminishing, and specifically to the brain, because the brain makes you aware or keeps you conscious. And if the blood flow through the brain or to the brain diminishes substantially, it leads to dizziness or passing out spell. Severe sweating, nausea and vomiting, palpitations, and then there's significant pain that can occur. Sometimes the pain goes to the jaw, the neck, the arm, the shoulder, or even to the back between the shoulder blades. The patients have complained about that kind of pain. Not necessarily chest pain, but many times it's accompanied by chest pain and radiating, we call it radiation pain, to various parts here as enumerated. Many times it just manifests as indigestion in the upper abdominal area, accompanied by nausea and vomiting and a severe sweating. Remember, unexplained severe sweating, unexplained fatigue or tiredness, that the patient is not able to move, or totally restrictive sensation where the patient can't even get out of the chair or the couch or the bed, that really should alarm one and say, look, this person is possibly having a heart attack, should consult the doctor or the hospital right away and call the emergency phone line and immediately get to the medical facility. A feeling of the doom or impending death is the other part, where patients sometimes feel that they may die, and that's the feeling of the doom or the impending death. So in a nutshell, these are the symptoms of heart attack resulting from a clot that happens within these 2 arteries. It may be the right coronary or the left coronary, and so it's very, very important that these symptoms should be recognized very, very seriously, and all these alarming symptoms and signs should immediately warrant a call to the doctor or to the hospital, and you should arrive immediately as soon as possible to the medical facility for immediate attention and treatment. I thank you for your attention, and we'll look forward to talking more in my subsequent sections. Thank you.